Imagine this. You recently had a baby and you're starting to feel some pelvic pressure and some heaviness down there. You're in a shower, and as you're cleaning, you put a hand down there, and lo and behold, it feels like something is coming out through the vagina. You're petrified. Is it your insides coming out? Is it a body part? Or worse, is it cancer? You run to your OBGYN, they do a very detailed pelvic exam and tell you you have stage 2 pelvic organ prolapse. But what does that even mean? Well, if you want to learn all about pelvic organ prolapse, then keep watching, because in today's video, we're going to be discussing just that. Hi everyone, I'm Dr. Nabila Noor, a board-certified and fellowship-trained urogynecologist and a pelvic reconstructive surgeon, and welcome back to my channel. If you're new and you like what you see, don't forget to subscribe and share it with a friend. Let's start with what is pelvic organ prolapse. So pelvic organ prolapse is a condition where your pelvic organs, which could be the uterus, the bladder, the rectum, or the intestines, are trying to push through the vaginal walls because of weakness of your pelvic floor muscles. Now, your pelvic floor is a combination of muscles, connective tissue, ligaments, which together forms the base of our torso, which is holding all these pelvic organs. Now, depending on which body part is coming down, your physician may sometimes give different names to pelvic organ prolapse. For example, you may have heard something called a cystocele, which essentially means the bladder is the part that's prolapsing or pushing down. There's also something called a rectocele, which means the rectum or that back vaginal wall is pushing down. Sometimes the uterus itself, which is the organ in the body that holds a baby during pregnancy, that organ itself can push down, something we called urovaginal prolapse. Sometimes it could be the small bowel that's coming out, and that's known as an enterocele. So again, depending on which body part or which pelvic organ is pushing through the vaginal wall, there are different terminologies and different names. So when you see your doctor and your doctor tells you that you have a cystocele or an enterocele or a rectocele or a uterine prolapse, understand they're all different names for pelvic organ prolapse depending on the body part that's coming through the vaginal canal. The next question I often get asked is that, why does pelvic organ prolapse happen? There are many risk factors for pelvic organ prolapse. Things like pregnancy, childbirth, trauma from childbirth, age, menopause, certain health conditions such as constipation, chronic cough, anything that puts a lot of pressure on your pelvic floor muscles or causes damage to the pelvic floor muscles and the nerves can cause those pelvic floor muscles to become weak. And over time, because of the weakness of the pelvic floor muscles, your pelvic organs essentially tries to push through the vaginal canal. Another big risk factor is obesity. Because again, being overweight or being heavy puts a lot of pressure on your pelvic floor, which can also affect your pelvic floor muscles and cause pelvic organ prolapse. So pregnancy, childbirth, trauma from childbirth, especially if you've had a vaginal delivery, can make you more susceptible to developing pelvic organ prolapse in the postpartum period. Especially with vaginal birth, as the baby is coming through the vagina, it can cause a lot of stretching, a lot of tear and laceration, which causes a lot of damage to your pelvic organ muscles. Oftentimes, they're nerve injury. Many times, your physicians may do a surgical cut called an episiotomy to make sure the baby's head can accommodate and come out easily. All these things can cause a lot of trauma to your pelvic floor muscles, which essentially causes them to become weak and then subsequently lead to pelvic organ prolapse. In addition, other risk factors can be obesity, things like heavy lifting, genetics, chronic constipation, chronic cough. Anything that puts a lot of pressure on your pelvic floor muscles can also make you more susceptible to developing pelvic organ prolapse. Another thing that we often forget is genetics. I have many patients who have never been pregnant or never had vaginal birth, and yet they suffer with pelvic organ prolapse. And when you ask them, they will tell you stories that their grandmother had pelvic organ prolapse, their mom or sister, their mom or older sister maybe had pelvic organ prolapse, and now they're suffering with it as well. So how would you know that you have pelvic organ prolapse? As I mentioned in my patient story earlier in the video, there are certain symptoms, things like feeling of vaginal pressure, heaviness, feeling like a bulge, as if something is protruding through the vagina. These are textbook symptoms that you could be having pelvic organ prolapse. Similarly, not being able to empty your bladder or empty your bowels completely, complaining of discomfort with intimacy or intercourse. not being able to insert a tampon during your menses. These are some symptoms and signs that you shouldn't be ignoring, because these could also be signs of pelvic organ prolapse. Unfortunately, many women, despite noticing that something is not right, feeling some of the symptoms I mentioned, even sometimes seeing a bulge coming out through the vagina, stay silent. And the reason for that is oftentimes many women are told, or they think, that this is a normal part of aging. Maybe they saw their grandmother suffering with it. Maybe they saw their mother suffering with it and just assume that this is a normal part of aging. As a urogynecologist who treats this condition on a daily basis, I can tell you that there is nothing normal about pelvic organ prolapse. It may be common, more common than you realize. 50% of women who have given vaginal birth will have pelvic organ prolapse of some sort. But just because it's common doesn't mean it's normal, and doesn't mean you shouldn't seek care and get the help and treatment that will give you back your quality of life that you deserve. So if you're somebody who's feeling these symptoms, don't ignore them. Make an appointment. Start with seeing your OBGYN. See what they say, and if you do have pelvic organ prolapse, then ask them to refer you to a specialist. There are some amazing treatment options that we have available to help patients suffering with pelvic organ prolapse. And not all treatment is surgery. There are many lifestyle changes that we can talk about. There are many conservative, meaning non-surgical treatment options we can talk about. And of course, for the patients who desire more definitive outcomes, there are also surgical treatment options. I will make separate videos talking about these treatment modalities, so make sure to check them out as well. Hope you found this video helpful, and if you did, don't forget to subscribe and also share it with a friend. Pelvic organ prolapse is a very treatable condition. So if you happen to discover symptoms or were given a diagnosis of pelvic organ prolapse, don't be scared. It is a very treatable disease. Start with learning about what it is, learning about the treatment choices, and continue to follow me for more helpful tips regarding your pelvic health.